Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches, and today is Friday, December 11th. Nice to welcome you again to another one of our videos. I'm here with Ed Brubaker, Living Branches President and CEO.
Yeah, it's good to be together again, and it's been 2 weeks, but it seems like 3 months. A lot going on.
And I feel like we should tell all of our viewers to grab a cup of coffee or some popcorn because we've got a lot to talk about today.
That's exactly right.
Yeah. So let's start, I guess, with case counts and where we are on each of the campuses. In Dock Woods, in Dock Gardens, which are our residential living apartments, right now we have 3 residents who are still testing positive and 6 have recovered. In the villas at Dock Woods, we have 1 resident testing positive with 2 people who we're classifying as recovered. In Dock Terrace, we currently have 5 residents who are positive. And then throughout staff at Dock Woods, we have 8 people who are positive right now. At Souderton, we have 1 person in the cottages who is positive. We have 4 people in healthcare who are residents who are positive, and we have 8 staff people who are positive throughout Souderton Mennonite Homes. And then at the Willows, we have 1 staff person who's positive. I think that's the longest list I've read.
I suspect it has been, and I think I may have mentioned on a previous video too, but I'll say it again. Back in the spring, I would talk to people in the community, and they would claim to not know anyone who had had COVID. Now, the reality is they may have known someone and it just, HIPAA and everything else, they didn't know. But as I thought about it, I knew people because of my work. That is no longer the case. This is spread so prolifically in the wider community and across the state and across the country. I don't think anyone today could say, I don't know someone personally or know of someone that has it. And as we talked about in previous videos too, the community positivity rate and the community spread rate, obviously we're part of the community, so that has the biggest impact on what happens within our walls. We are doing the best we can, and our staff are doing a yeoman's job working at this. But it is really difficult to keep it out when it's in the wider community, when our residents may or may not always follow the rules, but also just because of the ease at which the disease spreads, it's very tough to keep it in control.
There are differing community positivity rates depending on what website you're looking at, and are they counting the 7-day or the 14-day? But I think I heard Bruce Alder on our coronavirus response team say that if you're counting the 7-day in Montgomery County this week, it was 10.2%, and in Bucks County, it was 15.3%. That's a higher number than I've ever seen here.
Yeah, and there's other parts of the state that I've seen 30% and 35% in certain counties. I know Mifflin County in the center of the state or middle of the state is really getting hit hard. Huntington County, various other ones too. Lancaster County was as well. So yeah, it's all over. And we also, just to reiterate, when we're above 5% in healthcare, we need to test our staff once a week. Above 10%, it's twice a week. And that is a huge logistical challenge and a huge cost challenge too. It cost us almost $80,000 just for the month of November for testing. And I don't even think the whole month of November we were doing weekly testing and hadn't even started twice weekly. Of course, nowhere have we started twice weekly yet, but we anticipate that could happen. So it's logistically challenged, it's cost challenge, and also supply chain challenge too, because we can't always get the supplies, particularly for the rapid tests.
The marketing team, the sales counselors on the marketing team have been assisting the care teams with making phone calls to families once they find out that there's people testing positive in a particular area. So we hear the initial questions from family members. And one of the things that people want to know is, well, how did this happen? How did this get in? And, in some ways in the spring, you knew there were narrower paths of how it was getting to campuses. We were just talking today about this is the first time in healthcare at Satterton that they've experienced that they've experienced COVID positive residents. And so there are staff people at Satterton who are testing positive, but there have also been healthcare professionals who've been in seeing residents who've also tested positive. So how did it get there? Where did it come from? We're never going to know.
Yeah, that's exactly right. And there's people that were at family gatherings that tested positive. I've heard stories of, other businesses in the community or wherever it may be. So it's pretty much everywhere. And so it's coming in all different ways. And it's very, very challenging.
One of, I think, maybe the bright spots here is that, we had not really had COVID in residential living before. So at Dock Woods at one time, there were 9 persons in the apartments who had tested positive. To see that 6 are recovering, or we would classify them as already recovered because it's been more than 10 days and their symptoms have diminished. I was there last night and ran into one of those residents, and she looked fine. And I know that's no kind of metric, but it's still very reassuring. And she was sharing that she had been quite sick, but was pleased that she was able to recover. Obviously.
Yeah, and it really does impact people in different ways. I mean, I read a story about a 51-year-old physician in Houston that died. Now, the reality was he was caring for the sickest of the sick, and so that exposed him all the time. So that's a little different scenario. But nonetheless, he was fairly young. And other people in their 30s, I think Dr. Fauci's daughter's boyfriend's brother or something like that passed away from it, and I think he was 34. So and then you might have a 100-year-old who recovers from it. So there's no real explanation as to why one person goes in one direction or another. And frankly, I think, to be honest, people would take it more seriously if you knew if you had it, you would get really sick. Or we wouldn't have to take it as seriously if you knew you would get it and you really didn't get sick. But it's this business of it's a range of things that makes it so challenging. And I think, unfortunately, then also causes people who don't know someone who was really sick to take it seriously. And even sometimes, too, I'll be honest, politicians or their attorneys who broadcast things, too, well, it doesn't compare to you and I because the treatment plans they're getting are different. So it just gets really confusing out there with what is available and what's the true story, so to speak.
The other thing we talked about this week is that we are by no means alone in our area as retirement communities who are seeing this resurgence. And I didn't realize how much some other communities are experiencing this.
Yeah, there's communities in the Lancaster area and the Harrisburg area, even in our local community, that have had a lot of people test positive. Perhaps not even necessarily more than us, but if it's a smaller facility, they can't handle it as well as far as the real numbers. But yeah, a local facility, I won't name them because honestly, it could happen to any of us. But the National Guard was called in, and I was pleased to hear that they really did have a good experience with them. I hope we don't have to do that, but if we do, we know that that's kind of a backup emergency staffing plan, and it's good to know that it's a good option. But yeah, there's a lot of heartache out there and a lot of challenge.
It might be worth mentioning that when we talk about calling in the National Guard, it sounds like they're coming on campus to arrest you or something like that, and that's not at all what they're there for.
Well, they are coming to check to see if you're wearing a mask. No, kidding, of course. They're actually there to help. I'm not exactly sure if they always do direct care, but there's frankly people that are with the National Guard who are nurses and physicians and other people too. So sometimes you don't think about them as, okay, they have real professions other than when they're in the National Guard. So yeah, absolutely, they come in, and this facility found them to to be very helpful. And I know of other facilities that have used them as well. So it's really nice to be able to have that resource, and it's very much appreciated.
Well, and when we talk about the number of persons in Living Branches, staff persons who are testing positive, right now we have 17 people out who have tested positive. But between our 3 campuses, we have a total of 44 employees who aren't able to work because either they have symptoms or somebody in their family has symptoms. So it can take a huge divot into your staffing patterns.
Yeah, that's exactly right. And the interesting thing is, depending how the exposure was, a person that actually gets COVID might come back to work more quickly because of the quarantine periods that you have to go through to make sure that you're not coming down with it. I mean, if you have it, there's a pretty clear protocol, but if you don't, when might have you been exposed? What's your quarantine period, et cetera? And so that becomes more difficult. And frankly, those people that were exposed but don't get it, they could be exposed again in a week or two and go through the whole thing again. And so I would never wish this disease on anyone. But having said that, there's a clearer and maybe even more concise or compact way forward if you have the disease versus just being exposed to someone that had it.
Yep. Well, at least for me, one of the most interesting meetings we were in this week was with some clinicians from Penn Medicine. So maybe let's talk a little bit about that.
Yeah, it was interesting. I'd seen, actually, I think that CVS was involved with this as well, or Walgreens or someone. And so Dr. Hamowitz, our medical director, and I were talking about it a bit. And he made contact again with Dr. Josh Wee, who's with Penn, and geriatric specialist physician. And so we ended up getting connected through that with Penn and through their outpatient infusion therapy. And so, yeah, it's a monoclonal antibody therapy. I can say monoclonal antibody much easier than I can say the actual word.
I've been practicing.
Well, then why don't you go ahead?
Bamlanivimab. It's close.
That's very good. It starts with a B and ends with a B, right?
Yep.
So, it's a monoclonal antibody therapy that is approved for outpatient use. So it's through an IV, but it is outpatient. And it was very impressive speaking with Penn. Very good people, the physician that we spoke with and the person running the program. Very impressive people. And it looks like we have, not everyone's eligible, but it looked like we have 2 at Doc Woods that are eligible in healthcare. And we're looking at what the possibilities would be for Souderton and the residents here. So I don't see it as a silver bullet, as I reference things a lot. There's not one thing that's going to get us to the other side, and we'll talk about vaccines here in a moment too, but it's going to be a multitude of things, and we're hoping that for some people this can prove to be a good treatment. And as I said, Penn, I don't know that we've, possibly today or Monday will be our first one, so we haven't gone through it yet, but so far they've been wonderful to work with, and it'll be very good to see how that works out for our residents. Right now we're focusing on healthcare, and it needs to be within 10 days of a positive test. And there's a whole host of other things you need to go through too. You can't be using supplemental oxygen because of COVID. So there's things that would rule people out, but it's another tool in the toolbox for us to use, and we're really pleased. I think I was doing some more reading on it. I think it was sometime in November when it was approved, and it's approved for EUA, which would be an emergency use authorization by the FDA. So, it's another tool, and we're hoping that it can provide some relief for some people as well.
I think in the information that they shared with us, it said that people who had received this therapy had experienced 74% fewer rate of hospitalization, and their symptoms had been shortened from 8 days to 6 days of symptoms. So it seems like in some ways we've been on defense in everything that we're doing with COVID. So to have something that might provide a little bit of offense is very exciting.
Yeah. And I can't remember the exact numbers on some of these things, but part of it was to reduce that need for hospitalization and to try to relieve that pressure too. So that certainly would be one of the things. So we're looking forward to that as being part of our tools that we can use going forward.
Yeah.
Mm-hmm.
Well, the question that I've been getting from residents this week is all around vaccines.
Oh, you don't say.
I know you're surprised by that. So there's been a lot about this in the news lately, and so people are wondering, when is it coming? When can I get it? Or are you going to make me get it? Both of those questions I'm hearing.
Well, a couple of things, and I would say at the CRT, I pretty clearly said we're not going to require it. But we were also reminded by our medical doctor, or medical director, Dr. Hamowitz, that it's under an EUA as well, or it will be when it's officially, I think they're now talking tonight, it might get the official approval, emergency use authorization. So when a drug is under that, you can't mandate it anyway. Because of the process, I don't think we would be mandating it now. We don't know what may happen in the future, whether this becomes something you need to get annually or when you need to get it. And it's very possible it may be like a flu shot that we may mandate it for healthcare in the future. Having said that, the answer to that question is no, it will not be mandated. However, having said that, based on what we know of the process and the thorough process that is done with it and the positive results, generally speaking, we would recommend that people consider it. And it will be first available, as we understand it, through our partnership or our relationship with CVS, which is the one we chose, to be healthcare residents and healthcare employees. It's a little, maybe a bit, not confusing, but a bit unknown yet as to how wide that goes beyond. I think it's fairly clear they won't do it for residential living because they're coming out to our facilities, and so they wanted to give it to people who can't necessarily go in to get their vaccine done, and then also to healthcare workers. So that's who we anticipated being. We're looking at potentially the end of December. And so we have quite a bit of education that we need to do for people as well between now and then. But it's not going to be mandated, but we absolutely recommend that people seriously consider it, do their research, and we want to get information out to people as well so they can make an informed decision.
We've been talking about, in this country, we've been talking about vaccines, it seems like for months now. And I remember very clearly in the beginning of that discussion, Dr. Hamowitz was saying in one of our CRT meetings that he was not going to be comfortable recommending people get vaccines until he had had the opportunity to review some of the information and really make sure that it was a product that was coming out from a reputable company and it had science behind it. So I was pleased to hear him say in our last meeting that he did feel comfortable with the vaccines that we're going to be getting from CVS, which are coming from Pfizer, at least is my understanding now.
I think so. I'm not sure if it's Pfizer. Well, Moderna hasn't been approved yet, but it's likely Pfizer. Mm-hmm.
I think one of the things maybe that will be challenging for our staff persons and our residents is that, like you said, CVS is coming out. So it seems like in some ways people are going to have to make up their mind that if it's offered to me, I'm going to take it now. And we have no idea when it might be offered to you again. So the decision-making time frame is not very long on this.
That's true. On the other hand, it is a couple weeks until the end of December. So I would suggest that people start today. Don't wait till December 29th if the 30th is the day we're doing it. Start now. There's tons of information out there. And as I said, we want to post things on our website too and get information out. But start reading now. And the science of it is pretty fascinating just from that part too. And so you can learn a lot as to how vaccines are developed, how they are used. And I think it can kind of reduce the sense of misunderstanding and kind of the confusion out there to just do some reading and understand the research that went into this and how this works and how it's going to be working too. And I think if people do that, they can get to the point of being comfortable with it, I think, in most cases.
One of the things that was reassuring for me is that this vaccine does not contain live virus or dead virus. It works off of proteins, which I thought well, I didn't know anything about, of course, till I started doing some reading, but it did make it sound less scary than some of those worst case scenarios.
Yeah, and it would be different to, chemotherapy, drugs, and all those kind of things too. I mean, a vaccine is a different animal, so to speak. So, yeah, I would like to think that most people could get comfortable with it. And frankly, it is one of the ways, and I would say a significant way, that we will get to herd immunity that they talk about. Because herd immunity is not just everybody getting sick with COVID. I know that's how some people talk about it, but it's also getting to herd immunity through vaccine and other ways as well, vaccine or getting the disease being the primary ones, and then developing treatments as well too. But that's not a prevention tool. So yeah, it's one of those things that we're doing it for the good of ourselves, so we don't get the disease, but we're also doing it for the good of society.
Yeah. And it is kind of interesting that, in the spring, when this was just starting, people kept saying, I just need the vaccine. Where's the vaccine? Why don't we have any vaccines? And now here we are, and we're hearing, well, I'm not taking that vaccine. It's like, we got what we wanted, and we still don't want to do it. I guess we're contrary people.
Yes.
So you're not going to comment further on that?
No, I have some comments on that, but I think we'll do those off the record.
That sounds like a good idea. I also think that, and just to reiterate what you were saying about the information. So we're working right now to develop question and answer sheets that we'll be able to get out to our residents and to our family members that will have maybe synthesized information in there, as well as links to reputable websites that they can use to do as deep a dive into the vaccines as they would like to do. So that will
so
be
it's not going to be websites like edsvaccine.org or things like that. It'll
Correct.
be CDC and
Correct.
FDA and things like that.
Correct.
Yeah. And there's good information out there. There really is a lot of good information.
There's a lot of information. And so just trying to figure out, okay, how do you say this in a way that everyone can understand is a little bit challenging. So
yeah, and I think the other thing I would reflect on too, that meeting with the Penn people the other day and the physician, I thought she was great and just was able to explain it, was very calm, very reassuring. And this was about the monoclonal antibody therapy. But it just reminded me there are so many excellent and smart people out there working on this thing. We tend to see the stuff on Facebook or Instagram or Twitter or the news, and it's just politicized and all this kind of thing. But behind the scenes, the real people doing the work, nobody's perfect, obviously, but there are some really smart and really good people working on this that have the best interests in mind for us and for this country. And so I just, want to reflect on that again. There's some really excellent people working on this.
I think that's true in a global perspective, and I also have to say that's true at Living Branches. We're not working on vaccines, but every time I'm on a campus, I am reminded of what our staff are going through and how much love and care they're trying to put into their work.
Yeah, no, that's absolutely true, and I wanted to reflect on that too as part of our time today too, because it's been very hard. And I've been meeting with virtually with a number of teams over the last few weeks, and man, you can just read it on their faces. It's emotionally hard. It's physically hard. It's spiritually hard. It's just hard. And even just talking with the people from Souderton this morning, with their first cases, you could see some feeling, I think, of defeat. That, man, we let this in, but I wanted to reassure them, and I did too, that it's almost impossible to keep it out, and you have done so well. Now we're at a different stage, and we need to approach it in a different way. But it's really hard, and they are doing such excellent work, and they're doing it with not just a mask like this, a surgical mask. They have an N95 mask and a face shield and a gown, likely, perhaps gloves. I don't know if you've ever worn that stuff, but it is hot and it is sweaty and it is hard. And so, not that everyone has to have that level of PPE, but the direct caregivers do. And they have done excellent work, as has everyone else. The people that screen, the persons coming into work, visitors, there's just been unbelievable amounts of work that have been done, and really excellent work on the part of our staff.
Yeah, and I think to acknowledge that now that we're in the thick of it again, to not lose hope. You've been saying for months, we're going to get to the other side. And it really feels like maybe that other side is getting closer.
Yeah, it really does. But it's still months out, and perhaps even potentially more. But the point is, we will get there. But it is hard, and we just need to support each other in the meantime.
Yep. Any other closing thoughts?
I don't know, other than we understand we need to interpret that turkey joke from last time.
Yes, I did receive quite a bit of feedback about the turkey joke. Some folks thought it was hilarious, and some folks thought that we had a problem with our editing at the end of the video.
It was just our feeble attempt at humor, right? I think we said, how do you silence a turkey or something like that at Thanksgiving? And then, of course, the video cut off. The real question was, how do you keep a turkey in suspense? And then the video would cut off. So we messed it up a little bit, but I think it still had a decent effect, and we had some fun with it. And you need to find the humor sometimes too, right? These are challenging times, and we need to have some humor too. I think we also did get some suggestions about doing these videos weekly again. So we're going to look at that and see if we can do that. But it's probably a good idea to think about that, maybe shorten them up a little bit and do them more often, just because of everything that's happening with vaccines and monoclonal therapies and testing and positive cases and all that kind of thing. So we definitely will look at whether we can make that feasible.
And in the meantime, if you have questions, please feel free to email them to coronavirusquestions@livingbranches.org, and we will see you shortly. Thank you.